I find that many cancer survivors do want their own dedicated yoga classes. Some of them are kind of intimidated or embarrassed to go to a regular yoga class. If they're bald, if they're looking ill, they don't want people to ask them about it. They don't want to feel different. And for some people, that's not a big deal. But it's really nice to be in an environment where everyone understands what you're going through. It's also really nice to have a teacher who is experienced and knowledgeable in keeping you safe. There's some special considerations like lymphedema, or if you have metastasis of the cancer to your bones, or if you get dizzy a lot, there's a lot of blood pressure changes that can happen when you're going through cancer treatment. Now we'll start to do some strengthening movement for our legs. I call this one reverse bridge. Anna, go ahead and straighten your legs just a little bit more, maybe about 4 more inches, and rest the backs of your feet, the back of your heels on the ground, and lift the front part of your foot up towards the ceiling. Good. Feet close enough that you can put a block between your inner thighs, very gently hugging the block with your inner thighs. On your next inhale, push into your heels, engage your hamstrings, lift your glutes just a little bit. Good. And exhale, slowly come down. Excellent. We'll do that 3 more times. Strengthening and toning the muscles on the back of the legs and the glutes. And this should feel okay. It can be a little bit challenging, but we don't want you to feel like your whole body is heating up or your heart rate is racing. And that's really important when someone's going through cancer treatment. Keep heart rate in a really safe zone and don't overheat the body. Last one, nicely done. Good, and I'll remove the block. You can hug both knees into your chest to release the pose. From child's pose, start to move your arms, your torso, your head over to the right. You can just kind of pick up your arms and walk them over. Go as far as feels good to you. Just make sure your left hip stays in place on your heel. This is really nice for opening up the side body. So after surgery, really after any kind of illness or trauma, the muscles between our ribs can get so tight. So I want you to take some deeper breaths right now into your left lung. Perfect. Even into your left armpit. And if it feels good, you can even bend your right arm and use your right hand, perfect, for a little bit of leverage to open up more. Keep your left shoulder blade relaxing down your back. And if it feels good, you can rotate your ribs toward the floor or up toward the ceiling. That might give you a slightly different sensation and a better experience of the pose. Awesome. Bring your right arm back out in front of you and walk yourself back to center. Take a deep breath. And from child's pose, lift your torso up. Go ahead and push yourself up. Legs can stay in the same place. And we're going to come into supported child's pose. This is one of the nicest grounding poses. Also really good for nausea. From here, go ahead and fold forward. And you can turn your head to the right, left ear on the bolster. Perfect. Let your hips be heavy and relaxed. You can close your eyes. Good. Allow yourself to feel supported here by the bolster and by the earth. So you don't need to hold yourself up or hold still. You're just relaxing, doing great. This is a great pose also for insomnia, really nice to do before bed or anytime you feel anxious. On your next inhale, go ahead and push yourself back up. Good. Now I'll show you some movements that are nice for releasing tension in the side of your body, mobilizing the neck and the rib cage, which are areas that can get really tight after surgery or illness. Anna, now I'm going to show you some movements that are really nice for opening up your side body, getting some more mobility in your neck, in your shoulder, and really in the whole rib cage. These are all areas that can get tight from going through treatment, having a surgery, or even just any time we're ill and depressed, we kind of tend to contract a little bit. Go ahead and bring your right hand onto the floor and inhale your left arm up and over. Good. Keep some length in the right side of your body. Yeah, so we're strong here. Big inhale, big reach. And as you exhale, rotate your ribs. Cactus arm, look at left hand. Good. Inhale, reach up and over. Now look down to your right hand. Exhale, open your heart. Hips stay static. Good. Inhale, big reach. And we'll pause here. Allow right ear to release to right shoulder. And then start to lower your left arm, palm down, until you feel a stretch on the left side of your neck. And this should feel good. Just let your head be heavy. Peel open your collarbone. Good. You can even pull left shoulder blade down your back. And to release the pose, reach your left arm up and over. Grab the right side of your head gently. Use your arm in an inhale to pull yourself back to center. Well done. In addition to being a yoga therapist, I've also been a career coach since 1999. Most of my clients are yoga teachers or work in the health and wellness field. So I have a lot of experience coaching people on how to market their business in a way that feels good and authentic and allows them to make a big impact on their community. So for me, the internship is really kind of, the important part of this training because it's when you start teaching, it's when you build that confidence. It's also incredibly rewarding to do this work. And I want to make sure people just don't, keep all the information in their head, that they go out there and teach. That's the mission of Yoga for Survivors, is to have people starting classes, not just to have you learn something and know a little bit more, but to have you out there teaching. During the course, we have a fantastic array of guest speakers, all of whom have experience working in oncology with cancer survivors or with their caregivers. We have an excellent physiotherapist who comes in, a plastic surgeon, a psychotherapist, someone who works with loss and bereavement. What I think is one of the coolest parts of the course is that we have cancer survivors come in so that the yoga teachers, the course participants, can practice teaching, can start during the training, can start teaching cancer survivors. And for some people, it can be a little intimidating to get that first class out of the way. And I want to make sure that that first class is a positive experience done in a really supportive environment. The specialist course is open to any yoga teacher who's already completed a 200-hour teacher training. It can be any lineage, any style of yoga. And they have to have been teaching for at least 1 year, regular classes or privates in their community. Sometimes we'll have people who don't quite fit this criteria. Maybe someone who's a yoga practitioner is a cancer survivor and just wants to take the course for their own benefit, for their own personal growth. And if there is room in the course, we'll allow a few of those people in as well. If you're a yoga teacher who's completed a 200-hour teacher training, and maybe you haven't been teaching for quite a year, we can often find a way to work with you so that you can still take the course, get some additional teaching experience under your belt, and then go ahead and start the internship and start teaching cancer survivors. We encourage anyone who has a heart for working with cancer survivors to consider taking this course. You don't need any special training. You don't have to have had cancer yourself or had any experience working with cancer survivors. If you have a heart for working with cancer survivors and are interested in therapeutic applications of yoga, we invite you to consider this course.